IAB, the symptoms and laboratory findings of your patient suggest that the patient is likely suffering from vitamin B12 deficiency anemia, a condition where the body lacks enough healthy red blood cells due to insufficient vitamin B12. This deficiency can lead to neurological symptoms and is often associated with microcytic anemia, as indicated by the elevated corpuscular, corpuscular volume of 110 FL and low vitamin B12 values. Vitamin B12 deficiency occurs when there is an insufficient level of vitamin B12 in the body, which can lead to anemia and neurological issues. Genetics can influence this deficiency by affecting various biological processes related to vitamin B12. Anemia in older individuals can be caused by a deficiency of vitamin B12, leading to symptoms like fatigue and weakness. This deficiency can be due to age-related causes, age-related changes in the digestive system, dietary factors, medications, and underlying medical condition. Anemia resulting from vitamin B12 deficiency is known as megaloblastic anemia, and addressing it may involve dietary changes, B12 supplements, injections, and treating underlying causes. If anemia is suspected, it is crucial for older individuals to seek medical advice for proper diagnosis and tailored treatment to improve their overall health and well-being. The relationship between genetics and diet or nutrition in a patient with vitamin B12 deficiency involves understanding how genetic factors can affect the absorption, metabolism, and utilization of vitamin B12. There is a clear definition and criteria for understanding this relationship. The criteria for understanding the relationship are as follows. Genetic variation. Certain genetic mutations can affect the production of intrinsic factor, a protein necessary for vitamin B12 absorption in the gut. For example, mutation in the GIF gene can lead to pernicious anemia, a condition where vitamin B12 absorption is impaired. Second one, metabolic pathways. Genetic variations can influence enzymes involved in the metabolism of vitamin B12. For instance, mutations in the MTHFR gene can affect the conversion of homocysteine and methionine, a process that requires vitamin B12. The third one is dietary absorption. Genetics can affect how well the body absorbs vitamin B12 from dietary sources. Individuals with specific genetic profiles may require higher dietary intake or supplementation to maintain adequate levels. The fourth one is neurological impact. Genetic predispositions can influence the neurological manifestation of B12 deficiency. Some individuals may experience more severe neurological symptoms due to genetic factors affecting nerve function. The last one is nutritional interventions. Understanding the genetic basis of vitamin B12 deficiency can guide personalized dietary and supplementation strategy. For instance, individuals with certain genetic mutations may benefit from higher doses of oral B12 supplements or periodic B12 injections. So, by considering these genetic factors, healthcare providers can better tailor dietary and treatment plans for patients with vitamin B12 deficiency, improving their overall health outcomes So, here are the steps that should be taken by a healthcare provider to accomplish the above results. Assessment and diagnosis. They should evaluate the patient's symptoms, medical history, and blood test result. The combination of fatigue, dizziness, shortness of breath, headache, tingling sensation, pale skin, and a swollen red tongue, along with macrocytic anemia and low vitamin B12 levels, points towards vitamin B12 deficiency anemia. So, identifying underlying causes is important too. They should consider potential causes of vitamin B12 deficiency. The patient's recent diagnosis of gastritis and long-term use of antacids may contribute to malabsorption of vitamin B12, as these conditions can affect the stomach's ability to produce intrinsic factor necessary for vitamin B12 absorption. So, what are the treatment plan? They should recommend vitamin B12 supplementation. This can be administered through intramuscular injections initially, especially if absorption is impaired, followed by oral supplements once levels stabilize. The treatment aims to replenish vitamin B12 stores and alleviate symptoms. Also, monitoring and adjusting patient medication. They should schedule follow-up appointments to monitor the patient's response to treatment. Blood tests are repeated to assess hemoglobin level and vitamin B12 status. The healthcare provider may adjust the treatment plan based on the patient's progress and any persistent symptoms. Also, addressing the contributing factors. They should be able to advise patients on managing gastritis and acid reflux, potentially adjusting or changing medications that may interfere with vitamin B12 absorptions. Dietary recommendation may include food rich in vitamin B12, such as meat, fish, egg, and dairy products. The patient should be educated. The patient should be educated about the importance of adhering to the treatment plan and recognizing symptoms of vitamin B12 deficiency. The patient is informed about the potential need for lifelong monitoring and supplementation, especially if the underlying cause of malabsorption persists. In conclusion, pernicious anemia is an autoimmune condition that prevents the body from absorbing vitamin B12, leading to vitamin B12 deficiency. It is the most common cause of vitamin B12 deficiency worldwide, affecting about 1 in 1,000 people in the US. It is more common in Northern Europeans and women. Treatment is often necessary for life, but it can increase the risk of stomach cancer as well. The term pernicious means deadly and needs to be addressed. Thank you for introducing this topic and sharing your insights about pernicious anemia.